So one of the more far-fetched diagnostic tests that we do really raises a lot of questions sometimes from patients, and I understand that. One of the tests is called a Fundus Photograph, or Fundus Photography. Another term for it is a retina image. There's a lot of technical terms for it, but ultimately we are taking a picture of the back of the eye. And the patient may come here and they're coming in for back and leg pain, and they're wondering, why in the world am I getting a picture of my eyes when I see the eye doctor and I've got eyeglasses and my vision's okay or may not be okay, but ultimately, why are we doing this here? And so as a neurologist, it's important for us to evaluate the whole patient. And so part of the neurological examination that they teach you in medical school and then in neurology residency is called fundoscopy. Fundoscopy is a exam where we use a little fundoscope, a little tool that we can look inside the eye of the patient with the lights off, and what we're trying to capture is a view of the back of the eye by looking in the patient's eye. And why do we do that? Well, there's a lot of reasons. It's the part of the neurological exam, as I said. It's the second cranial nerve. Cranial nerve number 2 is the optic nerve that receives the visual information and sends it back to the brain. So there's a pathway there called a visual pathway. The back of the eye, we can see parts of that optic nerve. We can actually see the optic nerve head, if you will. And we can see if there are changes that are occurring in the brain itself. For example, pressure changes. So if there's increased pressure in the head, for example, then it will show up sometimes affecting the optic nerve that we see on the fundoscopy. So if somebody comes in for headache, as an example, a lot of times we can get a sense is if the patient were having increased intracranial pressure. That's important because that then opens up a list of potential diagnoses right there. Okay, but if you don't look back there, then you're not going to necessarily know. There's no way to test otherwise for increased pressure in the head. And so this is just one of the reasons neurologists will look at the back of the eye. Other reasons can be that we can get clues as to what kind of risk factors and disorders there are in the patient's body as a whole. So the back of the eye, when we're looking there with the fundoscope, it's kind of a picture that's worth 1,000 words, if you will. And so it kind of gives us a lot more information about the health of the patient. For example, the effect of diabetes or high sugars and how it affects the small blood vessels. That is going to translate into what the small blood vessels look like in the brain. And so in patients that are at risk for stroke in the deep parts of the brain, or for dementia due to what we call vascular dementia, if we want to know what the kidneys look like, then the small vessels in the back of the eye mimic what the small vessels look like in the kidneys. And so if diabetes is affecting the back of the eye, it's going to affect these other areas of the body. Why do I care about the kidneys? I'm not a kidney doctor, but I am a physician. All physicians should be concerned about kidneys because medications that are chosen half the time affect the kidneys and are cleared by the kidneys. So for example, a pain patient, they may have ibuprofen or the class of what we call NSAIDs. Those medications are damaging to kidneys. So I want to know, are there potentially any vascular issues in the kidneys that would play into the decision making of, should we put a patient on ibuprofen, or should we take them off of that because there's potentially more harm by placing them on that medication. So ultimately it's a safety measure is the whole notion there. Small vessel disease in the back of the eye, in the retina, also predicts stroke. It also predicts what we call peripheral artery disease, or PAD, which is disease of the blood vessels in the legs, for instance. And it also predicts mortality or the risk of death from heart attacks and coronary artery disease. All of a sudden now this becomes a very important thing to look at, right? Because we're looking at big picture items, and just by looking at the back of the eye. So neurologists are automatically trained to look there, and this gives us a big view of other parts of the body and how the machinery kind of works, and it plays into how I make decisions about treatment. It's important to note that when a neurologist, even in trained hands, uses a small fundoscope to look in the eye, there's some limitations there. There's studies that look at this among trained neurologists and ophthalmologists in using this type of technology, and find that about 50% of the time we can capture the actual picture itself when we're looking at it, but it's 50% of the time. Other times it's very hard to see the back of the eye doing a standard manual fundoscopic examination. And so at Mcgreevy Neurohealth, we have invested into a product, an actual machinery that is very high tech. And it is able to capture the fundus, or the back of the eye, the retina, 80 to 90% of the time with crisp images. And this is a savable photograph. So this photograph then becomes a part of the patient's medical file and serves as a comparison measure to future images. And that picture can be reviewed time and time again, and we can always come back to it, versus a snapshot with the manual fundoscope, where it's really in the physician's head as to whether they can remember what they saw, and over the course of time that's just not going to be a realistic expectation of the physician. So having an actual photograph and having it inside the patient's chart, and then being able to refer to it in the future, I think is invaluable.